Morning erections. So what does that tell you about your overall health? And if you've noticed any changes, then you will want to listen to this. Welcome back to the channel. It's me, your host, Dr. Debra Durst, and my co-host.
Hey guys, Farideh Golombieski, nurse practitioner here at Revitalize MD. So we're going to talk about morning erections. Dr. Durst, please tell me, why do men get morning erections?
So, obviously we've all heard the term before, but sometimes you hear the term of morning wood, right? Or morning boner. There's always jokes, about that, no matter what, in any social circumstance, right? At least at anything we're at. But anyhow, the thing that happens with morning erections is, again, it is related to your sleep cycle. And so REM sleep, and when you're in REM sleep is when that typically happens. So it's interesting that an erection is related to sleep, but it's because during that REM sleep with the rapid eye movements, you're more frequently to wake up right after. So it's one of the last cycles in the morning, but also your parasympathetic increases. So
what does that mean exactly?
It means that you relax your blood vessels because you're relaxed. Parasympathetic, that fight and flight. Sympathetic is flight. You're scared, you're leaving. Parasympathetic is relaxed. So that's a relaxed period of time when your blood flow and smooth muscles relax and increase blood flow into the penis. So
and we know when smooth muscles relax, blood flow goes.
Yeah, you get increased blood flow. We talked about this with Botox in previous, where I would almost think of it as a muscle relaxant. Why would you use it? The penis is a blood vessel. But the penis is a blood vessel because the blood vessels are surrounded by smooth muscle. And when you relax that in REM sleep, then you get increased blood flow and erections. And you also get a boost of testosterone in the REM cycle.
Well, that's why they say men's testosterone is highest in the morning.
Mm-hmm. Also related to more heart attacks just because of that testosterone in the morning. They thought that was something that we had done way back.
That's
hard to remember.
That's been way back.
Yeah, it was that. But
we may have to revisit that.
But it's because of that testosterone boost, and so that's at least what it was thought to, because that peaks between 6 and 9 a.m. So anyhow, that's one reason. And so you have REM sleep causing a relaxation of your blood vessel walls, increased blood flow, and a testosterone boost. And obviously we have testosterone receptors in the penis. And so therefore it increases your responsiveness of that erectile tissue to your hormones.
What about nerve function? How does that play a role?
Well, obviously when you're talking about erections, it really still is a connection between your brain, your spinal cord, and the nerves in your penis. And so that connection has to be there for that to work. And so most of the time you're not dealing with something that isn't, because it's not too often that we come in and there's some diagnosed neurologic problem. That doesn't happen. But if you have one, then you'll have issues with erections, but also just local nerve regeneration, because over time we decrease that sensitivity in the nerves. And so therefore your erections aren't as strong, but also your orgasms aren't as strong or as easy to obtain. So that neuro connection is crucial, but I think if you think about what affects it, drugs or medications can, and also blood pressure medicine. So anything that affects your nerve function is an issue.
Or blood flow.
Yeah. Or affective, like disorders, like so that you have a antidepressant or an anti-anxiety or even stimulants also, but that's probably more of a blood vessel. So, and that's like the next one, right? So blood vessel, again, a response of everything else that's going on, your parasympathetic, your hormones, and then you get that blood vessel dilation or enlargement and increased blood flow, stronger erections in the morning.
And that's essentially how your Viagras and Cialis work, is to dilate for blood flow, but that happens naturally because of REM.
Overall, I think that this is a great just barometer of health. So morning erections, just a fun fact, 95% of healthy men will have frequent and regular morning erections. So it happens and it's not related to arousal. Again, rapid eye movement is dreaming, but it's not frequently reported to be related to anything from a dream state. It's everything physiologically going on. And so it is a barometer of overall, how's the nerve functioning? How's your blood vessel health down there?
How's your testosterone levels?
Do you need to have your hormones checked? But one of the smallest blood vessels in the body are the penile blood vessels, 1 to 2 millimeters. So some of the smallest in the body, coronary arteries being 4 to 5, carotids being larger than that. So it's the first thing that's going to be affected just as a barometer of vascular health. So
I feel like that is one question that men do get asked if they bring up anything sexual wellness in a primary care, is something that is asked is, well, are you still getting morning erections? Because it is a barometer of health for so many other things. But that's kind of like, I feel like the screener for men for erectile dysfunction in primary care. Anything beyond that, they don't really seem to ask. But that is one. We were just talking about on another podcast how it's not being discussed in primary care, sexual health or sexual wellness. But that is one of the questions that they do ask.
Yeah. Well, and I think that, erection scoring or, is your erection consistently hard enough? That shim score, is a little more difficult and complex, but I think you're right. This is a good screening. And I think that men probably bring this up as a screening, like, hey, my morning erections have decreased. Like, I don't have them. What does that mean? Probably before they would say, I'm not staying hard, throughout sex. Sometimes just having stronger erections and that PD5 is a more simple conversation than anything in depth. But this is a great screener. I think you're probably right. So basically, you're looking at lifestyle changes that you can do because it's a barometer of health. You want healthy morning erections. That's part of it. Again, not related to arousal. It's physiologically something that's good that's going on in your body. So making sure your sleep is good would be one of them. One of the things you can do.
Getting your hormones checked.
Yes. Making sure that your testosterone's good and everything else. So free testosterone, your binding globulin, your estradiol, the whole picture for men is important. And then even from a fitness, making sure that you're active, you're getting in resistance training, and that's an important part of your, daily routine. And then
healthy
nutrition.
diet.
Yeah.
Nutrition's always on the list.
Yeah.
It always follows exercise.
Yeah. So healthy foods, parameter of the store. And you've heard us talk about that before, but lots of protein, healthy fats, all of that are huge for, and again, not taking any neuroactive substances, anything that like is a stimulant, like Adderall would be one of them, anti-anxiety, antidepressants, anything that could potentially affect your nerve function would be important. So medications and alcohol.
Alcohol's the other one.
That's a big one.
What about circulation? So heart health, getting cardiovascular activity in, nitric oxide support. That's another one that's huge for sexual wellness.
Yeah. And if you think that's increasing blood flow throughout and healthy blood flow. So yeah, absolutely.
Supporting that whole cardiovascular system.
Yeah. Insulin resistance, the cholesterol panels, anything that lead to cardiovascular health. Absolutely. So I think it comes down to the regular things that you're going to do to keep yourself healthy overall. If you've noticed a change in your morning erections, that is a signal to you to make sure that you have a checkup with your doctor, addressing all the things we just talked about. And from a health standpoint or a lifestyle standpoint before you get there, consider in detail your sleep and how you can change things from a nutrition and a fitness standpoint. You don't need the doctor to tell you that. There's enough information out there. But hormones, again, having a hormonal panel checked would be important at that point. But
even simple things like nitric oxide support, so supplementation, Kegels for men, right? For nerve health, pelvic floor, strengthen the pelvic floor. That can play a huge role. So there are things like Dr. Durst pointed out that you don't need to go see a specialist to tell you.
Yes. Yeah.
Outside of hormones.
Yes. And then otherwise, look at everything you're doing. Yeah. And then take that in there if you are seeing them for blood pressure checks or cardiovascular or hormonal checks. It'd be nice for you to go in with that information so that you guys can have a very complex, comprehensive, I should say, conversation related to your change in erections. So there's a lot to be said for it. So open those conversations with your doctor and let us know how you've handled this in the past, or does your doctor bring up anything related to erections when you walk into the office, and let us know the conversations you have had.
Yeah. What did you try? Did you notice a change in erectile function in the morning and do something that we didn't mention? Let us know in the comments.
And if you're not having changes with sexual function, but you're having some morning erection changes, for those that have had that journey already, let us know if they tie together a change in the morning erections to, any kind of sexual dysfunction as well. But anyhow, let us know if there's anything else you want to talk about, because we are willing to deep dive into anything sexual wellness or wellness.